Hi, I'm Dr. Anna Cronky from CLEAR. Welcome to Tips for How to Use Your CADE Profile. Here we're looking at a profile for Patrick. His mom has already completed it, and we're looking at her results. Patrick is an 8-year-old boy, and we want to talk about tips for how his mom can use the profile, specifically thinking about how to target treatment. So let's take a look at this communicating profile we have here. So from this profile, we can start to think about what might help Patrick. And it's going to be important to pick just 2 or 3 targets initially, and then we can look at the progress over time across those domains. So let's say Patrick is going to be working with a speech pathologist, maybe at school, maybe in the community, but he does have some moderate concerns in communicating, and so we want to address those. Looking at what's going on with Patrick, I'm pretty concerned about monologues and response to name. So monologues means that Patrick is often talking on and on about a topic without pausing to let his conversation partner speak or without posing questions. He's basically giving us a lecture. And that relates a little bit to narrative coherence, which is another challenge that he has, albeit to a slightly lesser degree. And that's going to mean that Patrick is sometimes telling stories that don't really make sense. He can talk on, but maybe no beginning, middle, or end. So if I was going to sit down with a speech therapist and talk about my concerns for Patrick's profile as his mom, I would say, 2 things I really want to work on are the monologues and the narrative coherence. I want Patrick to be able to go back and forth with someone versus just talking at them. And I want him to be able to shape his thoughts into beginning, middle, and end. So from this profile, I think those would be good targets for Patrick to get started. Another easy target that you might discuss with your therapist is response to name. So Patrick's often checking out and he's not responding when someone calls his name. So maybe putting a simple reinforcement system in place to give positive reinforcement when Patrick responds to his name, or adding something like a gentle tap on the shoulder or a signal from the therapist or from his teacher to indicate that he needs to be paying attention. So in this case, Patrick might be just zoning out, and a few little reminders may get him on track to respond more frequently to what's going on around him. Well, those are some ideas from Patrick's profile as to how you as a parent might talk to his therapist, either at school or in the community, about some of your goals for Patrick. And then a few months later, you can always come back in, reassess, and you'll be able to use our monitoring tab to compare this first data point to new data after you've gotten some treatment. Thanks so much for watching this short tip from CLEAR. Have a great day.